Kathy. Hello, everyone, and welcome to the session. As Kathy said, I'm a pediatric neurology and neuromuscular consultant at Evelina London Children's Hospital. Next one, please. These are my disclosures. Next. So as you know, and you have already heard from others, since the standards of care were published in 2018 in Lancet, quite a few of us neuromuscular consultants who are part of the NOSTA network collaborated with the Duchenne UK and other parent organizations and the Newcastle University to adapt the standards of care to the UK healthcare, and we formed several expert working groups to achieve this. And I was a medical lead for one of them, the emergency care working group. So the aim of this session is to, sort of provide you with an overview of take-home messages from the emergency care perspective and the voice present to the ED, and also, familiarize yourself with the app. And Nick and Kathy will talk about it in more detail later. Next, please. So we'll look at some of their presentation to the ED. One thing I wanted to say is you'll probably hear these points from other working groups as well when they cover their own subspecialty that they're working on. However, what we are providing here is the perspective from when they present to the ED. So whenever there's a need for surgery, any surgery, that includes not just the, say, orthopedic surgery or peg insertion, but also things like tooth extraction, etc. It's important to remember some depolarizing agents like methonium and also the inhaled anesthetics could cause severe side effects in boys with PMD. So it's always ensuring that the anesthetic team is informed and so on. It's also worth checking what the cardiac status is before proceeding with the surgery, particularly if they are older, as they might have developed cardiomyopathy since their last clinic review, so something to bear in mind. So this applies to any emergency surgery needing general anesthetics. Next one, please. Hypoventilation is may occur in older boys. It's important to remember that they may need ventilation rather than just high flow oxygen when they're present with chest infections to the emergency department. Just giving the high flow oxygen when they're actually needing ventilation could cause further respiratory suppression. Most of these boys do have respiratory care plan, so it's worth remembering that and asking for one. Next one, please. So it's very common to see boys with DMD present to the ED with fractures. There is reduced mobility, and in some boys, no mobility, which causes osteoporosis. They also take steroids, which further increases the risk of osteoporosis. So they're at risk of fractures. It's also important to remember they may have vertebral fractures and not just long bone fractures. That's important. And then something else to remember is if a boy is able to walk even small distances, just 5 to 10 meters inside home, that may make a huge difference to their daily life, quality of life, and it's important to retain that. So what we do know is prolonged immobilization may result in permanent loss of that ability to walk, even if it's a short distance. So when they present with fractures, particularly long bone fractures, it's important to remember this could happen and consider internal fixation and early mobilization if at all possible. I need to mention fat embolism, but I've got a separate slide for that. So next, please. So long-term steroids could cause adrenal insufficiency. Almost everyone nowadays has an emergency plan, and this should be asked for. It usually includes some extra steroid for mild to moderate problems, and if they're needing orthopedic surgery or chest infections, hydrocortisone injections and such. Something else to remember as well is even if they have presented with just diarrhea and vomiting, they could be having an adrenal crisis just because they've been on long-term steroids. Next, please. As I mentioned earlier, cardiomyopathy we should look for in older non-ambulant boys, particularly. Nowadays, most of them are on prophylactic ACE inhibitors. If there's any need for urgent surgery or something else, it is reasonable to request a cardiology review with an echocardiogram, as things could have changed since the last clinic review. Next slide, please. I mentioned fat embolism. So what is fat embolism and why is it important? It's rare but preventable. So essentially, in very osteoporotic bones following fractures or orthopedic surgery, small fat droplets can be released from the bone marrow, and that could become lodged in the pulmonary circulation or in the systemic circulation and cause microinfarcts. Unfortunately, there are no validated diagnostic criteria, so we need to have a strong clinical suspicion, particularly if boys with DMD, with the above history I said, following fractures or orthopedic surgery, etc., have increased rate of breathing, work of breathing, drowsiness, confusion, fever, reduced urine output, jaundice, and so on. So, watch out for it. If they have that, consider it. I know I've just given bullet points for most of those, but I hope they kind of stick somewhere. And if people need them at the time, they could look it up. Now we move on to the next one. Next slide, please. Oh, the another thing to remember, as I almost forgot, was many of these boys have learning and behavioral difficulties and autism, and they may really struggle in the emergency department setting, or in fact, any unfamiliar setting. So that's something to bear in mind and address when they're present. Next slide, please. When we set up the emergency care working group, one of the things we discussed was the feedback from the families as to how much of a struggle it is to recall all the medical information when an emergency happens, and to pass this on to the ED staff. And the fact that not all ED staff everywhere in every small center may be familiar with the rare presentations that we have mentioned in boys with DMD. So we worked on this app to be used in case of emergency, to provide all the information that is necessary, all the relevant information to the ED staff. So something I want to make clear is these are not new guidelines or anything. These are clinical correspondence, which may include personalized care plans for the individual boy. There may be sick day steroid plan, a respiratory care plan, etc. So we're not reinventing the wheel, but at the flick of a thumb, or you could bring up the app and go into the details and look at all these and share this with the ED easily. You can see the next few slides, which has some pictures of the app being used. And the next one, please. And the next one. And the next one. And the last one. Thank you. Now I shall let Nick and Kathy take over.
Thanks very much, Vasantha. So actually these slides here, I just wanted to talk through very, very briefly, and then give Nick 5 minutes or so if you want to make any comments. So the app, as Vasantha has described, is available to be downloaded now onto your phone. And it really goes back to one of the things that was actually mentioned in our meeting yesterday about putting information in the hands of the patients, so that we can try our best to educate everybody we can involved in treating boys with Duchenne, including in an emergency. But the one way we can guarantee the information will be with the boys to put it, or the man with Duchenne, is to put it in their hands. So that's what the app does. You download it onto your phone, you input information about yourself or about your child into that app, and it generates a personalized alert, really, that sits on your phone. You can show it in an emergency situation, in an emergency department. or you can generate a PDF and print it out and keep that with you. So there's lots of different ways that you can use it. It also gives you reassurance. And we know from patients and families that have used it, that access to reliable information, just to remind you of those things you need to bear in mind in an emergency. And it's been really valuable. At the moment, it's not cloud-based, it's based on your phone. The advantage of that is there's no issues about data sharing or anything like that. The disadvantage is that if you want it on one device and another device, you have to enter the information twice. We are going to be looking at a release of a second version of that in 2023 that hopefully will address those issues based on feedback we've had already from using it. But it's still great as it is at the moment to use.
Can I just say something?
Yeah,
About those,
Yeah.
about the medical team details, I think is really important, particularly to everyone in this room. In an emergency situation, I can tell you as a parent, you're not going to be running out of the room, getting in an ambulance with all your details to hand. Most things go out of your head. So to have your neuromuscular consultant, cardiologist, and so on, endocrinologist on this app readily available to first responders, A&E clinical teams. I think it is one of the most important things, that information that we can give to people, because those clinicians can contact you, the experts, directly.
Yeah, thanks, Nick. So that information goes in. It also collects information about any allergies, your steroid regime, and you can upload a copy of your steroid plan. You can take photographs of clinical letters and so on and upload those as well. Any other medications, latest weight, respiratory status, cardiomyopathy, and so on. You can see the information there. So it contains a lot of information about that individual. This is the PDF that can be generated. This is the most detailed level of information. You can push directly from the app. You can push this PDF, you put in an email address, and it will email that PDF to anyone you want it to your child's school, to your parents, friends, to the emergency doctor who you see in hospital, whoever you want to, or you can just print it out yourself and keep a hard copy. So I'll give the last couple of minutes to Nick if there's anything else you want to add, and then if there's a few questions.
Yes, there is a couple of things, I think, from a parent and patient perspective. I think the first thing to say is that this app is something, funnily enough, that we hope you never have to use, but it can be literally a lifesaver. And I think the 2 points I wanted to make is that from a parent or a young person or adult's perspective, of filling this in is a education in itself, and that's really, really important. I'm not standing here saying that we want parents to become as expert as all you guys in the room. That's not what we're talking about. But in my experience with my son and visits to clinics and discussing things with experts, the more I understand, the more knowledge I have, the more empowered I feel. And most importantly, it enables me to ask you guys the right questions. I mean, I thought John's presentation on the heart there was fantastic. It reminded me of a question that confused me for so long. What the hell is LVF? I don't know, and what the hell is FVC? But actually, on this app, you have to fill that in from your clinical notes. And what better way of going back to you guys and saying, well, could you just tell me what LVF is, please? And what is the significance of 20%, 30%, or whatever? And why is it going up or down? And that's empowering for us. The more we can, we're not going to become experts, but the more we can understand about this condition and managing this condition, the better. But however, this, I mean, what I've taken away from today is how incredibly complex the management of Duchenne muscular dystrophy is, and the need for the expertise that has been developed, and that you really can't see that PDF, but that PDF contains not only all the information that the patient has put down about medical teams, their own personal information, and so on and so on. It also you know, it also gives all the background to the research, you know, the expert advice that is immediately accessible to anybody that you give that to. So I think this is really important particularly for parents to understand who should have that PDF, that information. Now, as Kathy said, on the app you can put in anybody's email address, because don't forget it's your personal data, so you can decide who to give it to. You can send that PDF immediately to you know, a doctor in A&E, or you can send it to your grandparents if they're staying the weekend. Most importantly, I think particularly for adults with Duchenne, you are going to have my son's got 4 or 5 personal assistants, carers, and they're with him all of the time. I mean, you know, I'm not with him all that much now. And they, in an emergency situation, you know, me and Jan say is about schools and education, because actually our boys spend a lot of time at school, at secondary school, at college, and even at university these days. And having this information is absolutely critical. If there are, because, you know, the fractures, for example, are much more likely to happen at school probably than oh, I don't know, maybe they do or don't, I don't know. But schools have a responsibility actually to produce risk assessments, and they should be, if the boys have got education, health and care plans, most of them do have, then those risk assessments come under annual review. And I think we need to get those annual reviews to say to parents and special needs coordinators and teachers, has this person got this PDF? Has the app been filled in? Who's holding that piece of paper, if you like, or that PDF when you know, there's an emergency situation at school, the ambulance turns up, who is giving that information to the first responders? That's you know, that's really crucial information. No, this is the last thing. The last thing is, please, all the clinical teams here, you know, at clinic, can you please encourage, ask a simple question in your reviews. Have you filled in the A and E Duchenne app? Have you completed it? You know, because that simple question, you'll find out whether they've done it or not. And if you have done it, have you got any questions about what you filled in? Is there anything you don't understand? Because we can explain it. And